Is sponsored by Springfield Clinic. In studio today, we have Dr. Ashish Chopra with Springfield Clinic. Thank you so much for being here.
Thanks for having me.
Of course. Well, March is Colon Cancer Awareness Month, and we want to talk about those colonoscopies.
Sure.
First off, let's talk about the importance of Colon Cancer Awareness Month. Why should people, care and be mindful of this?
Sure. So colonoscopies are tools that we use all the time to detect changes to the lining of the colon. Specifically, in this case, looking for polyps, which are growths that, if left alone, could turn into colon cancer. So by doing a colonoscopy, you can remove those polyps, which decreases the risk of turning into colon cancer, and in some cases eliminates that risk. Or you can find colon cancers earlier, which gets patients to the appropriate treatment sooner than if they would not have had a colonoscopy. So the colonoscopy is very important to screen those patients.
Who do you find that colon cancer mostly impacts? Is it a male, female issue? Is it everybody?
It's everybody, and that's why we're getting the word out about screening.
Yeah.
Patients may have no symptoms at all and say, hey doc, why do I need to have this procedure done? And the whole reason is you can't feel polyps growing inside of you. So we recommend screening for most patients at the age of 50, male or female, even if you're not having any symptoms.
And talk about some of those symptoms if you do, if you do feel like you need to go get a screening.
Yeah, some patients will have abdominal pain, they'll have unintentional weight loss, change in bowel habits, some will have some rectal bleeding. Those things are all to look out for changes or symptoms of colon cancer. But other patients may have no symptoms at all. They may have a family history of colon cancer, which may need to get screened sooner than the age of 50 that I talked about earlier.
How would you encourage those people out there who may be a little scared about the process?
Sure, I tell them I understand. I mean, it's an invasive medical procedure.
Yeah.
But the hard part is not the procedure. The patients are asleep for that. The hard part is actually the day before, where they have to fast for a day, they have to drink a laxative to cleanse the colon. So what I tell them is the benefit of colonoscopy to prevent colon cancer or find it sooner, in my opinion, outweighs the inconvenience of drinking the prep or the risks that are inherent in any medical procedure.
Yes, great advice. Now let's talk about some of those dangers. If somebody is seeing some of those signs, but they haven't been to their local doctor to talk about it, talk about the risk factors and the dangers that come with that.
Sure. I mean, if you're having any symptoms, if it just doesn't feel right or things aren't going like you expect them to go, talk to your doctor. Your doctor can screen you with a questionnaire, can send you to our office to get the procedures done or get evaluated at the very least to see if you're a candidate for those procedures.
Okay. Is it something that's easy to schedule?
Oh, absolutely. You just go see your doctor, and now the electronic system, you don't even have to have papers anymore.
Perfect. Now, if somebody wants to contact you, how can they do it?
So we're at 217-528-7541. That's the Springfield Clinic, and ask for the gastroenterology office.
All right, Doc. Thank you so much.
Thank
March
you.
is Colon Cancer Awareness Month, everybody. Make sure you know it. All right. Coming up next.